Welcome back to Frank Assessment, where underwriting is everything. I am your host for the program, Tim Moynihan, and I am very happy to welcome our third guest. His name, Jason Landy, Vice President and Sales Advisor here at BSMG, who, by the way, came in from Connecticut to our BSMG studios here in Providence. Jason Landy, welcome to Frank Assessment, buddy.
Tim, good morning. Great to be with you, and
Morning.
it's always great to be back in Providence.
Great to have you here. Jason, we were talking yesterday, and you were sharing with me a couple of your field underwriting calls with producers and a common malady. Share it with me, buddy.
Sure. I mean, Tim, something that's coming up on a daily basis is diabetes.
Yep.
My producers have a lot of clients who have diabetes, and specifically the question that I'm being asked is, what's the difference between a type 1 and a type 2 diabetic?
Great question, and thank you for the lead in, Jason. Let's start with type 2s. Type 2s, the more common malady. 90% of diabetes cases in this country are type 2s. In type 2s, we're usually being diagnosed in adulthood, aka adult onset diabetes. In this instance, our treatment method is primarily not insulin, primarily an oral agent, a common one being metformin, glucophage. Type 1s, diagnosed earlier. These are your juvenile diabetics. Type 1s are diagnosed in adolescence, primarily prior to age 30. Insulin is the primary treatment method. It can be insulin boluses by injection. More commonly now, it is an insulin pump. Commonly, you're looking at your iPhone, where we are right now, being utilized as the glucose monitoring device on a real-time basis, monitoring your current glucose and giving you a bolus automatically to keep you nice and even keel. However, with both types of diabetes, Jason, the common and the key method to look at the control is your glycohemoglobin, your A1C. That's the driver for every underwriter. Every home office is looking at that A1C as the method for control pricing.
So I'm assuming, Tim, the better control, the better pricing we can assume on the case.
You're spot on there, my friend. And the better the control, the better the pricing. Let's look at type 2s. Type 2s with good physician follow-up, be that usually with the PCP in a type 2, sometimes the endocrinologist, but primarily the PCP. I'm looking for A1C numbers, low 7s. With type 2s, their A1C should be a little bit better because they're not requiring insulin. I'm looking for something maybe in the high 6s. You're looking at standard. If you have quality A1Cs in a type 2 diabetic, good physician follow-up, uncommon to have a complication. Background diabetic retinopathy, peripheral vascular disease, peripheral neuropathy, fingers, toes, renal impairments. You're looking at standard. But let's talk about type 1s, Jason. Type 1s, more difficult. A1Cs, you can be a little bit more liberal here. Like to have them 7.5, maybe go a little bit higher and down from there with regard to your glycohemoglobin. I'm also wanting more constant physician follow-up. I'd like to see an endocrinologist here as well. I'm looking to make sure that there are no complications where these are more common in type 1s. Diabetic retinopathy, your eyes, peripheral neuropathy, fingers, toes again. You're really looking at that kidney function, your blood urea nitrogen, your creatinine. You're looking for protein and albumin in the urine here, Jason.
Okay.
So a good type 1, table 2. Might get a standard every now and then, but table 2. Table 3, table 4, the more common mechanism, it goes up from there based on control, Jason.
Okay, thanks, Tim.
You're welcome.
Obviously, we're in an interesting environment. Carriers have been, putting a lot of restrictions in place when it comes to underwriting. Can you touch on how carriers are kind of viewing diabetes right now in the COVID environment?
Very, very timely question, buddy. 5 months ago, when this all started, I think my date is March 14th, and the shackles were put on from an underwriting pricing standpoint. And it wasn't just diabetes, but metabolic disorders were looked at very, very closely. And diabetes in particular was a very restrictive impairment early on during the pandemic. Let's go through March, April, May into June, where the pricing I just referenced, Jason, was not always there. It was more conservative. And there were many, many declines, Jason, just because you're an insulin-dependent diabetic.
Okay.
Today, Jason, not so much. I've seen a loosening of those underwriting strings. I know you like to hear that.
I love to hear
I love to hear it too,
underwriting.
my brother. And I think we're back into a more consistent pre-pandemic underwriting focus, which I'm very happy about, and I know you're very happy
Oh,
about.
absolutely. That's some great news, Tim. Thank you.
It is great news. Hey, by the way, thanks for joining us here. And before I let you go, ladies and gentlemen, if you want to know more about how BSMG handles diabetes underwriting, and you want to know more about how RDU works inside that segment, call us. Call BSMG. Call Jason Landy. And before I let you go, don't you ever forget, I want you to join us for the next episode of Frank Assessment, where underwriting is everything.